I shall talk to you about blood vomiting. Blood vomiting in medical terms called hematemesis is a very scary condition. Imagine somebody suddenly vomits blood into the wash basin. It's scary, and all hell will break loose. How common is this condition? See, as gastroenterologists we see these things often, but it's not a very common condition. One has to differentiate between blood into the basin after brushing teeth, which can come from the teeth, gums, and in some others patients will cough out blood. It's called hematemesis, and that is due to some lung condition. One has to be careful when hematemesis is there. It could be tuberculosis, it could be something related to smoking, sometimes it can be something serious also. Hematemesis is not spitting blood from the cheeks or from the lungs. Hematemesis is vomiting out blood from the food pipe and stomach and so on. What are the causes of hematemesis? The two most important causes, one is portal hypertension. In people who have been drinking alcohol for a long time or who developed jaundice and cirrhosis of the liver, where the liver become very hard, it will lead to blood vessels of the stomach and food pipe opening up and vomiting of blood. And also in some other patients, younger patients especially, an ulcer in the food pipe or in the stomach can give rise to blood vomiting. So, blood vomiting hematemesis is a very serious condition, and if anybody had an episode of blood vomiting, immediately they have to go see a doctor, and the doctor often does what is called endoscopy, where they put in a tube through the mouth into the food pipe and stomach to see what is the cause, whether it is the blood vessels bulging due to liver disease or it is an ulcer which is bleeding. Depending on that, we should decide on further treatment, because we should not ignore this symptom, because next time when they vomit lot of blood, they may drop dead also. So, if it is a liver disease induced blood vomiting due to what is called esophageal varices, we have to find out as to what is the cause of the liver disease, whether it is due to alcohol or B virus, C virus, or certain other conditions which occurs in the younger age group, where the livers are more or less normal. Depending upon what the liver condition is, these varices have been treated. Either they will do rubber banding of the varices 3 or 4 times to make them disappear. At the same time, we should also treat the liver disease so that these things do not happen again. If it is an ulcer which is bleeding, many a time the bleeding would have stopped, but if it continued to bleed, we will do through the endoscope, we will give some injection in the ulcer area, so the bleeding will stop, and then later on the patient will be put on drugs, medicines like proton pump inhibitors, with which they become all right. Very few patients who are bleeding massively and this endangering their life are the ones who will require some sort of an emergency operation, in which we are specialists, where we go in and find out which is the site of bleeding. We will try to stitch that bleeder up, and sometimes we remove that part of the stomach where the ulcers are. So, blood vomiting, otherwise called hematemesis, is not a simple symptom. It should be differentiated from hematemesis, where you cough out blood, or even bleeding just from the mouth due to some dental condition. Once hematemesis is diagnosed, we should find out the cause of hematemesis by certain tests, especially endoscopy and liver function tests and so on. And a number of times these are treated by endoscopic treatment like rubber banding of the varices or injection of the ulcers, but in a handful of patients, when these measures fail, a surgeon has to come in and do some emergency surgery. The results of the emergency surgery are not that good, but many a times these surgeries are life saving. Thank you.